What to do if you accidentally took a double dose of tirzepatide. Accidentally taking a double dose of tirzepatide typically causes intensified gastrointestinal symptoms like severe nausea and vomiting, with hypoglycemia risk primarily in patients taking concurrent insulin or sulfonylureas. If you've accidentally taken a double dose of tirzepatide, you're probably wondering what's going to happen and what you should do right now. Let's walk through this together so you know exactly what to expect and how to stay safe. Tirzepatide is a dual GIP and GLP-1 receptor agonist. You might know it as Mounjaro for type 2 diabetes or Zepbound for weight management. At normal doses, it enhances insulin secretion, suppresses glucagon, slows gastric emptying, and reduces appetite. When you accidentally take twice the amount, all of these effects get amplified. The most common issue you'll face is intensified gastrointestinal symptoms. We're talking severe nausea, persistent vomiting, and abdominal discomfort. This happens because tirzepatide has an enhanced effect on how your stomach moves food through your digestive system. And here's something important about timing. Tirzepatide has a half-life of about 5 days and reaches peak concentration around 24 to 48 hours after injection. That means symptoms might not hit immediately, and they could stick around for several days. Now, let's talk about low blood sugar or hypoglycemia. If you're only taking tirzepatide by itself, your risk of hypoglycemia is generally low because tirzepatide works in a glucose-dependent way. But if you're also taking insulin or sulfonylureas, that's a different story. The combination significantly increases your risk of low blood sugar. If you're on these medications, you should monitor your blood glucose more frequently and watch closely for signs of hypoglycemia. How severe your symptoms are depends on several factors: the specific dose you took, your individual tolerance, what other medications you're on, how well your kidneys are functioning, and when you last ate all play a role. So, what should you do if this happens? First, don't panic. There's no specific antidote for tirzepatide, but supportive care is generally effective. Contact your healthcare provider right away and let them know what happened. They can give you personalized guidance based on your situation. You can also call Poison Control at 1-800-222-1222. They're available 24/7 and can provide additional support. While you're waiting to hear back, stay hydrated if you can tolerate fluids. If you're experiencing vomiting, small sips of water or electrolyte drinks can help. If you have a home glucose meter and you're taking insulin or sulfonylureas, check your blood glucose regularly and treat any low blood sugar promptly. Follow the 15-15 rule. If your glucose is below 70, consume 15 grams of carbohydrate, wait 15 minutes, and recheck. Here's something important about your next dose. Do not take an extra dose to try to compensate or adjust timing. Resume your normal dosing schedule at your next regularly scheduled injection time unless your healthcare provider advises otherwise. This is different from trying to make up for a missed dose, so don't adjust on your own. Let's talk about warning signs that mean you need immediate medical attention. If you're vomiting so much that you can't keep fluids down, that's a red flag. Severe or worsening abdominal pain is another. If you're on insulin or sulfonylureas and you notice symptoms of low blood sugar like shakiness, confusion, rapid heartbeat, or sweating, that's urgent. Signs of dehydration like dizziness, decreased urination, or extreme thirst also warrant immediate care. And if you have any symptoms that feel severe or concerning to you, trust your instincts and seek help. Now, how do you prevent this from happening in the future? Set up a system that works for you. Mark your calendar or set a phone reminder immediately after each injection. Some people find it helpful to keep a medication log where they write down the date and time of each dose. Store your medication in the same place and develop a consistent routine around when and where you inject. If you use a pre-filled pen, check it after dosing to confirm it's empty. Talk to your doctor about what to do if you miss a dose. The guidance varies depending on how much time has passed, and having a clear plan in advance can prevent confusion. Remember, tirzepatide is a powerful medication, and dosing accuracy matters. The doses are carefully calibrated to balance effectiveness with tolerability. Taking more doesn't mean better results, it just means more side effects. To recap, accidentally doubling your tirzepatide dose most commonly causes severe nausea and vomiting that can last several days. Low blood sugar is mainly a concern if you're also taking insulin or sulfonylureas. If you do double dose, contact your healthcare provider or poison control right away for guidance, and resume your normal schedule at the next injection time unless advised otherwise. This information is educational, but it's not a substitute for personalized medical advice. Always consult your healthcare professional about your specific situation, especially if you've taken too much medication. Have you found a system that helps you keep track of your medications? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.